a Medicare plan can be confusing for seniors, especially understanding the difference between original Medicare and Medicare Advantage.
Medicare is a government-managed healthcare program, and so even within that space, you have private companies like Humana that offer Medicare Advantage plans. These Medicare Advantage plans are going to offer additional benefits. They're going to help these individuals maybe cover some gaps that they may find. Original Medicare typically is only going to cover 80% or so of the bill, but that individual can go and see any provider that they want that accepts Medicare in that area.
And for the 9 million veterans who turn to the VA for health care, it's important to understand that it's not an either-or situation.
In fact, the Department of Veterans Affairs recommends that our veterans do enroll in Medicare if they're eligible. So there's a couple of different reasons they may want to do that. If that veteran ever wants to be able to go outside of the VA system and see a provider or a doctor outside of the VA, then they're probably going to want to have a different plan in order to do that. If there's ever any funding changes with the VA, that's something to consider as well. They're probably going to want to have a backup for that in the future. They're going to have lots of different options, from different copay options, different premiums, different deductibles, max out-of-pockets, things like that.
And Humana has teamed up with USAA to specifically honor vets and their spouses.
It's a shared commitment to our military community. And I think together we combine, the health expertise of Humana with the veteran expertise of USAA. And this year we're especially excited because all of Humana's veteran-focused Medicare Advantage plans are now going to be co-branded as Humana USAA Honor plans, and they'll be available to more beneficiaries in more locations. And these plans were all designed with the very unique needs of our veterans in mind.
Those needs include mental health resources.
We know that the veteran suicide rate is 57% higher than the national average. And so getting any kind of, resources or care for behavioral health conditions, it's important to our overall health, even our physical health. So USAA, in support from Humana Foundation and others, we've launched what we're calling Face the Fight. It's a coalition to help raise awareness of veteran suicide and to really help break the stigma of actually asking for help. And there are resources on that website, wefacethefight.org, that could be helpful for anyone who may be struggling.
The annual enrollment period ends December 7th, so visit Medicare.gov and Humana.com/Medicare/veterans for more info.